Hello, our presentation today is on the nursing shortage and the impact on patient safety by Allison Moore Muskerkun and Cynthia Lewisell. The objectives of our presentation are as follows. We will be defining the current and projected nursing shortage, explaining why the shortage exists, explaining how the nursing shortage is impacting patient care, defining policies for safe nurse-to-patient ratios, what is being done to address the shortage, examining if anything good can come from the nursing shortage, and finally explaining how the nursing shortage will directly impact the nursing profession. According to the American Association of Colleges of Nursing, the United States is projected to experience a shortage of registered nurses that is expected to intensify as baby boomers age and the need for healthcare grows. Making the problem worse is the fact that nursing schools across the country are having difficulty to expanding capacity to meet the ever-growing demand for care given the national move toward healthcare reform. The Bureau of Labor Statistics Employment projects registered nursing is listed among the top occupations in terms of job growth through the year 2026. The RN workforce is expected to grow from 2.9 million in 2016 to 3.4 million in 2026. This is an increase of 438,100 nurses, or 15%. The Bureau also projects the need for an additional 203,700 new RNs each year through 2026 to fill not only newly created positions, but also to replace those of the retiring nurses. A shortage of registered nurses is projected to spread across the country between 2009 and 2030. In this state-by-state analysis, the authors forecast the RN shortage to be the most intense in the South and the West. As a result, there is a growing realization that the supply of appropriately prepared nurses is inadequate to meet the needs of a diverse population, and that this shortfall will grow more serious throughout the next 20 years. Some potential issues of concern that could be contributing to the nursing shortage is the aging population. As the population ages, the need for healthcare services increases as older persons typically have a multitude of diagnoses and comorbidities, and this requires them to seek treatment. The older population is surviving longer, and this is causing increased use of health services as many disease processes that may once have been terminal are now survivable for the long term, and this can put a strain on the workforce that is treating these illnesses. The nursing workforce is also aging, and it is projected that 1/3 of the workforce could be in retirement in the next 10 to 15 years. This puts nursing faculty at a shortage and leads to enrollment limitations and ultimately limiting the number of nurses that a nursing school can generate. Nurse burnout also causes a lot of nurses to leave the profession, and this causes turnover, as burnout leaves the nurse feeling physically, emotionally, and mentally distressed. Another contributing factor is many nurses are still majority female, and often during childbearing years. They will want to leave or cut back on hours to start a family, and many do not return. Nursing shortage amounts can vary greatly depending on the region of the country as well. Higher shortages are seen in different areas depending on the specialty of nursing. Some areas may have real deficits when looking at critical care nurses, labor and delivery, or other specialties. Violence in the healthcare setting also plays a role in the nursing shortage. If a nurse feels the presence of a threat to emotional or physical abuse, this makes for a stressful job environment and poor job satisfaction, as it takes a toll on the well-being of the nurse. It is becoming very common for nurses to work 12-hour shifts and pick up additional hours to help bridge the gap in the nursing shortage. However, these long shifts are affecting the nurse's well-being, causing burnout, and this can highly affect patient care. Sometimes the exhaustion can lead to medical mistakes that can cause patient injury or even death. Patients can be given the wrong medication, the wrong dose, or the medication can be given to the wrong patient. Charting errors can be made and failure to ask for assistance when needed. This can all affect morbidity and mortality rates. The nursing shortage is causing inadequate staffing levels, and this is linked to higher rates of patient falls, infections, and pressure ulcers. Along with the massive reduction in nursing budgets combined with the challenges presented by a growing nursing shortage, fewer nurses work longer hours and care for sicker patients.
With input from the American Nurses Association, the Registered Nurses Safe Staffing Act of 2014 was introduced to the U.S. Senate. To address the issue of safe nurse-to-patient ratio, the American Nurses Safe Staffing Act was implemented in 7 states: Connecticut, Illinois, Texas, Oregon, Ohio, Washington, and Nevada. This act requires that an appropriate number of registered nurses provide direct patient care in each unit and on each shift of the hospital to ensure staffing levels that address the unique characteristics of the patients and hospital units and result in the delivery of safe, quality patient care consistent with specified requirements. The Act requires each participating hospital to establish a hospital nurse staffing committee which will implement this plan. It also sets forth a whistleblower protection against discrimination and retaliation involving patients or employees of the hospital for their grievances, complaints, or involvement in investigations relating to the plan. A bill recently reintroduced in 2019 is the Nurse Staffing Standards for Hospital Patient Safety and Quality Care Act, sponsored by Senator Sherrod Brown and Representative Jan Schakowsky in the House. This important legislation addresses the understaffing in our nation's hospitals and puts patients and the public at risk. Currently, California is the only state in the nation with mandated nurse-to-patient ratios across all of the units for all shifts. The research from California provides irrefutable proof that adequate minimum nurse-to-patient ratios save lives. In 2002, Johnson & Johnson launched a campaign for the future of nursing in order to promote careers in nursing and improve the image. Johnson & Johnson has worked to change the trajectory of health for humanity by advocating for, empowering, and supporting nurses around the world. The campaign includes TV commercials, a website, recruitment video, and brochures. Hospital system initiatives include competitive pay, flexible schedules, and plentiful training resources that will help hospital systems in retaining and developing their nursing staff, as well as drawing in new hires. As retention increases, facilities will lose less money through turnover and be able to focus their financial resources in other areas that need improvement. Statewide initiatives to address both the nursing shortage of RNs and nurse educators include the University of Minnesota in 2013 partnered with Minnesota VA healthcare system to expand enrollment in the university's BSN program in hopes to enhance the care for their veterans. In 2014, the University of Wisconsin instated the Nurses for Wisconsin initiative to provide fellowships and loan forgiveness for nursing students who agree to teach after graduation. What good can come from a nursing shortage? With increased recognition on the nursing shortage epidemic, increased professional recognition has emerged. Nurses' hard work is noticed and an appreciation for the crucial job that they do is recognized. High performance standards have also been set. Poor work performance that increases the workload for others is not tolerated. Incivility creating a toxic work environment has also been investigated. Facilities aim for the promotion of retention and morale by investment in a good quality staff. Hiring the right people for the right role has been seen as essential. By the restructuring of the workflow, nurses will have more time to perform the daily tasks that they need to complete. This will help to increase productivity and employee satisfaction. Nursing shortages directly contribute to increased healthcare costs. One study reported that hospitals with inadequate staffing are positively correlated with higher readmission rates. According to the Center for Medicare and Medicaid Services, avoidable hospital readmission costs are approximately $26 billion annually. High patient-to-nurse ratios are also associated with increased urinary tract infections as well as surgical site infections. Nursing shortages may result in the loss of tax revenue, potentially creating or increasing budget deficits for local, state, and even federal government. Decreased tax revenue directly translates into less funding for other crucial projects to include infrastructure, education, and medical needs for the population. According to Snavely, RN turnover rates are 17.2%, with 24% of hospitals reporting a vacancy rate of 10% or higher. The average cost of turnover for a bedside RN ranges from $36,900 to $57,300, resulting in the average hospital losing $4.9 to $7.6 million annually. Lastly, nursing shortages can result in reduced access to health care simply because there are not enough caregivers to provide for all of those in need. Listed on the next two slides are the references that we used for our presentation. I thank you for watching our presentation, and I hope that we were able to inform you about the current and projected nursing shortage and its effects on patient safety and care. Thank you.